Here we go.
This meeting is being recorded.
So as usual, please do, if you don't want to be recorded, keep your video off. You can put messages in the chat, we'll keep looking at that. And you're always very welcome to email us any questions. So here's the agenda today. We've got Steve Turnbull giving us our data update, Georgia Butler, update on communications, Dash is going to talk about the vaccine updates, and I've got a little message from our deaf ex-mainstreamers. So over to you, please, Steve.
Okay, thanks, Tracy. If you move on to the next slide, please. I'll try and do some of these slides fairly quickly. Oh, not that quickly.
Oh, sorry.
But just about one more, please, Tracy.
Sorry, I'm admitting people at the same time. Multitasking.
No problem. So this shows, as you're well aware, this shows our case rate going back to November time to the current day. And you'll see the big Omicron wave in the middle there. And that came up very quickly and then came down really quickly. And it's continuing to head downwards, which is really good news. And most of the other slides show that rates are reducing. We would just be a little bit cautious about the data because with people now being able to just report positive cases on LFTs and not PCRs, they don't always record them. People's testing behaviours are changing, and people are not always testing when they possibly should do. So numbers are not as accurate as they once were, but generally it's still heading the right direction. That's true of most of the country. We're probably West Yorkshire, Wakefield, West Yorkshire, probably one of the lowest areas in the country at the minute. So we're in a good and if not better position than many other areas. If you just move on to the next slide, please, Tracy, and that will show our positivity rates, which is the proportion of tests that come back positive, and our testing rates, and you can see they both come down. So fewer people are getting tested because there's possibly less infection out there. And as I said, suggested there's changes in people's behaviours around testing. But the positivity rates have come down and are almost back at the level from the pre-Omicron wave. So that's another good sign. So we're reassured that what we're seeing is genuinely happening out there on that basis. And if you move on to the next one, please, that shows testing rates by age range, and you can see it's pretty much stable now with, as you would imagine, higher testing rates in people who are more out and about and lower ones in the younger age groups who are less concerned about the impact of COVID. And if you move on to the next slide, you see case rates by age group, and you can see the real clear pattern that it's getting less in each age group. So it's going from the darker colours to the lighter colours. Whichever age group you look at, you can still see some higher rates in the school age population. So 5 to 10-year-olds, primary school still fairly high, and 11 to 16-year-olds also fairly high. Vaccination coverage is obviously less in those age groups, and hardly at all, obviously, in the primary school age groups. So you can see that they're still having some infections. But overall, rates in schools have come down. We've got far fewer schools having outbreaks, and actually it's settling down quite well. So we're hopeful that continues, especially with half term coming up. If you move on, please, Tracy.
Oops.
And this again just shows age ranges. So in the older age ranges, because we're obviously the older you are, the more chance you have of having a difficult experience of COVID and needing some extra care. And we can see that some of our rates were quite stubborn for a while, but there's again started to continue to come down, and that's been replicated into the hospital admissions, which we'll come on to. If we just flick on one more, and then this just goes through the same data, but for the working age adults. We were concerned at one point that the 25 to 59s would be maintained high because of infections through school age kids, because these are often parents, and they're a little higher, but it's becoming less. It's slowing down, and the general, just seeing Pam's message there, we are. I mean, these are reported cases. We do think there's probably more out there than is replicated here. We think it's coming down, but maybe not quite so low as has been suggested. So there's still because testing behaviours have changed and will continue to change, and I'll come on to that in a little while. Just move on to the next one, we'll probably look at children rates. Yeah, so you can see that's a bit noisy, and as I suggested, you've got still quite high rates in teenagers and primary school kids as well. So, but still heading in the right direction. And this is the kind of one that helps us to understand this, because we would see outbreaks in schools, and we if the rates were higher but not being reported, we'd be able to see that in absence figures, and it's actually improved quite a lot. So that's why one of the reasons why we think it's genuinely coming down, but again, maybe not as fast as the data suggests. Just move on to the next one, please. And then you see that all together, which is a very noisy slide and makes it hard to see. So we'll just skip on. One more, please, Tracy. By local areas, you can see all across the district. It's fairly even all the way across Wakefield district. Some areas are maintaining fairly high levels, but generally speaking, it seems to be evening out across everywhere. And you'll see that on the next slide, which is the map. So you can see some areas still got some high rates. Some areas are starting to go into blue, which is a lower category. So and this will fluctuate. It changes on a week by week basis quite rapidly, but it's nice to see that head in the right direction. And if we go on to the next slide, we can see what happens in terms of hospital admission. So this is Mid Yorkshire attendances because of admissions because of COVID-19. And you can see how the Omicron wave did lead to an increase in hospitalizations, and we've started to come down quite rapidly off the back of that. So admissions always lag behind rates, but we can see that's now starting to come down. And talking to the hospital this morning, that they're even lower than those figures. So again, that's really good news. What the hospital also are finding is there's very small numbers of people who are now being admitted because of COVID. There are people who are in there for other reasons that they're also testing positive, which does mean that the hospital have got to care for them in a careful way so we don't get hospital outbreaks. So it does still put pressure on hospitals, but overall the numbers are coming down. And next slide, please, Tracy. And you can see there, as in the same way that admissions lag behind case rates, deaths lag behind admissions, and we're still seeing a slight increase in number of deaths, which is because of the Omicron wave, but that will fluctuate up and down, and we expect that hopefully to start to reduce in the next couple of weeks. But as you can see, we've not had a week without a COVID death right back to June. So it does, even though things are looking a lot better, it's worth just reflecting on the journey we've been on in the last 2 years, that this is, with all the vaccination program, all the work that we've done to protect ourselves and our communities has really helped. But this is still obviously a disease that has been taking quite a few lives in the past few months. So next slide, please, Tracy. And obviously, I mentioned vaccinations. They're starting to get, obviously, with very high rates of vaccination in Wakefield, and a good proportion of the more higher risk groups having boosters. There's still some work to do. Anything we can do to encourage people to get boosted or to have their first or second doses is really, really important. Because as you can see on the right hand side, there's still 46,000 people who've not been vaccinated, and we'd love them to come forward. That's a really important thing to try and get people jabbed whilst we can. So that's really important. Next slide, please. And then this is a really good question, which I'll move on to. So this question is about people catching COVID. I guess we all know people in the past 6 weeks since the Omicron wave started indeed that you'll know lots of people have been infected. I certainly know more people. I can see the sense in the question. And if you look at the next slide, I'll try and answer this. This is going back to September 2020 when we first started to get good testing data. So what we always focus on is the lines, and these are the lines across West Yorkshire. But what you've got to think about is it's the amount of white space beneath the lines is really there. So it's the area under the graph, and if you can see, the Omicron wave is so big that actually more people have been infected in the last Omicron wave than in lots of the rest of the pandemic. I remember writing a blog probably a couple of years back when we talked about 1,500 people a week being infected, and that was at a quite high rate. At the Omicron wave, we were getting 6,000-7,000 people infected every week. It was something like one person every couple of minutes was in effect being infected. So it was a huge wave of infections, and that will still be rumbling on out there, which you can see the graph has come down. It probably will be a lot higher than it is on there because people are possibly not getting tested, but will still be reporting symptoms. So whilst we've got access to testing, it's still sensible to follow that guidance. We do expect next week to be national announcements about the future strategy about living with COVID. Living with COVID doesn't mean pretending it's not there. It means trying to get back to more normality, but bearing in mind the journey we've been on. We don't want it to come back at high levels. We don't want people to be at risk of being in hospital or having to be absent from work because they're not well, and we certainly don't want people dying. So then the next week we'll start to share more about what the government's strategy will be, and that will probably look at like less testing, less access to testing, and possibly removing the legal requirement to isolate if you are COVID positive. It will probably move to be guidance only, but we'll have to wait and see what it says in the detail next week. But I think that's everything from me, unless there's any more questions, Tracy.
Thank you very much, Steve. I'll just have a look in the chat. Does anybody have any questions for Steve? Message from Pam. Do you think that this data is reliable? Personal experience is that more people have COVID now or the last few weeks than any previous time, and others have been saying the same.
Yeah, and I think that's a genuine thing. I think a lot of people still do have COVID, and I think the data shows a pattern, and it has come down from those very, very extremely high rates. But so I think it's generally coming down, but I do think there's probably more transmission there than the data shows, which is probably why over the next few weeks we'll probably start to change the way we talk about the data. What we don't want to do is give out data that suggests everything is all well when actually we know there's infections out there, and so the data is less reliable now than it has been at any point in the pandemic, really, apart from the early days. But we are used to dealing with infectious diseases without this level of detail. So we normally manage flu without testing everybody, without understanding exactly what's going on. We look for patterns, we look for outbreaks, and that's what we'll probably move to, handling COVID in the same way over the next few months.
Thank you very much, Steve. Pam's got a hand up. Pam, would you like to say something?
Yes, I wonder, Steve, it is actually two things. I mean, one is that the issue that we live with flu, we live with colds and that, but of course, having flu or having a cold doesn't get you into the situation that other countries won't let you in, and you can't go on holiday when you've got something booked, and your insurance company will compensate you for that. So I think there's a big issue around by living with it, we're perhaps also restricting people's movements overall. But the other thing that I've picked up in the last few days is that Canada a country with half the population of the UK actually has a death rate, or the number of deaths is less than a quarter, so about half that of the UK, yet they were much slower in getting their vaccine programme off the ground. This sort of March last year, very few people had been vaccinated. So I wondered if you'd got any comment on why they might have such a low actual death rate.
Okay, I'll touch first on the international question and travel, because we were talking about that in our team meeting this morning, and that will be an issue. And so it'll be interesting to see. I don't have any answers. It'll be interesting to see what the government specify next week in their strategy about access to testing for travel. In terms of Canada, I mean, there's lots of we can compare any country with any country, but it's really difficult to do that in a meaningful way. For a couple of reasons. One, they may not measure. This may sound daft, but they may not count the deaths in the same way. So we've got to understand exactly what their numbers mean and compared to ours. But also it might be that the population is very different in some way. So, for example, we may have a much older population than Canada. I don't know whether that's the case, but if we have, then older people are more at risk of dying from COVID. So we need to do what's called adjusting for age. So we make a comparison, but look at it against what it would look like if everybody had the same type of population. And whilst Canada's population is half of ours, and it will be concentrated in some big cities, it's also a very rural country. They may have half the people, but they've certainly got quite a lot of land. So they may be able to put natural breaks between communities to prevent it spreading in the way that it does in such a densely populated country such as ours, when it moves very rapidly between communities. So it's difficult to make international comparisons. And so just be cautioned that. But I think at the end of the day, we have, you can see in our death figures, we've had a significant number of deaths in our country from the pandemic, and that's something to be mindful of when we think about how we handle it going forward. Because we certainly don't want to see any increases in those numbers.
Thank you.
Thank you. Have we got any more questions for Steve? No, can't see anybody's hands up. So thank you very much, Steve, for that excellent presentation. And now we've got George from our communications team. Over to you, George.
Hi, everybody. So just some news regarding travel. Anyone that's thinking about traveling abroad, when you come back from being abroad, the rules have changed as of the 11th of February. So if you go to the next slide. So these are the main points. You won't have to test when you return. All you'll need to do is fill in a passenger locator form. The only people that will have to test are those that aren't fully vaccinated, and they'll have to take a pre-departure test 2 days before they arrive. Take a pre-departure test and then another PCR 2 days after they arrive. And also children 12 to 15 will be able to use the COVID pass for outbound travel. And then I've just put the link there to the government website, which has got the full information. So if we go to the next slide, this is just to let you know that if you are going to be traveling abroad, that you do need to check the entry requirements for your destination country. The change from country to country, and it's not possible to list all the details. So it's a matter of checking with your travel agent, or if you're booking independently, checking with the consulate of the country in question. Next slide. So this is the post that we used to go out with the Valentine's Day video. So if we go to the next slide, if we could play the video. This is the video that we put out for the Valentine's Day.
It's the little things that you do that make our hearts swell.
The sacrifice that's led to our protection.
2 long years of private, selfless acts.
Every gesture has been rooted in affection.
Every hand freshly sanitised, every jab, every booster.
Every face mask in a crowded public place.
Rolling sleeves up with Yorkshire grit and grace. So here's our heartfelt thanks
to every one of you for proving
it's love that keeps us moving.
So that was the culmination of our Valentine's campaign. The video went out on Valentine's Day on Monday. So that's everything from me. Thank you.
And I'm mightily impressed with myself that I managed to show a video and get some volume as well. Thank you very much for that, George. Have we got any questions for George? No. Oh, Val, disappointed that our video wasn't chosen. Val, so am I. There were several of our champions that came forward and offered very early on to take part in some of the filming. I have no idea why some were chosen over others. I think we were trying to look at diversity of all different ranges. I really don't know, Val, but I can ask the question of Ebony. Ebony's the lady that put all the stuff together, and I think she did ask for 2 or 3 volunteers to record the same sentence, if you like. But thank you so much for volunteering and for going to the trouble of making it, and I will ask Ebony for feedback. No, I think we've got Darsha then. Over to you, Darsha.
Thank you. And it is a lovely video, and thank you to everyone who contributed for that. So going back to the vaccination, it's just a quick recap of who is eligible. So we know that everyone over the age of 16 and over, and as Steve was showing in his slides, it is a group of, particularly the young people, are a group that we really want to encourage to come forward. Children aged 12 to 15, and I've just listed all the places where they can get vaccination. At the moment for England, we are vaccinating some children aged 5 to 11, but as you may have seen in national press, both Wales and Scotland have moved to wider vaccination of 5 to 11-year-olds. So once we have an update, we will share that. In terms of information of where you can get vaccination locally, and as well as links to national information, we've included the link to our CCG website. It does have clinics, and they are updated at moment's notice when we know about vaccination clinics. They are broken down by age cohorts as well, so you can see for those who are over 18, over 16, or over 12 clinics, and there are some running over half term as well. So for anyone who wants to have that bit of flexibility over half term, please have a look. On the next slide, I've just included a couple of posters for clinics that our roving team are doing. So we've got a women only clinic on the 16th of February, which is running today. And on Friday, 18th of February, we've got accessible clinic. So by accessible, we mean any accessibility needs that people may have. We are looking at providing a friendly environment to people. And if anyone is interested in attending, if they could just drop us a note to Natalie, whose email address is noted, we would share that. There is also a clinic running next week, which is Friday 25th of February at Agri Community Centre as well, which is an open over 16s clinic, over 12, sorry. And on the next slide, I've just included a reminder that both flu and COVID can bring a greater risk to women who are pregnant, as well as their babies. So we are encouraging anyone, all expectant or new mothers, to come forward for their doses of COVID-19 vaccine. And in conclusion, I think my last slide is similar to George, thinking about half term and forthcoming holidays. As we are thinking about going away and going abroad, like George was saying, in terms of checking the requirements of the countries where we are visiting, it's also thinking about that extra reassurance for COVID vaccination and looking for appointments. In terms of travel, as George mentioned, the digital COVID certificate can be used by those who are 12 and over to prove their vaccination status. For those who may not be able to access it digitally, the 119 service can also provide that in paper copy by calling them. So I thought I'd just mention that might be useful for people. And the last thing really around vaccination is we would really appreciate for all COVID community champions to share any ideas, thoughts or suggestions in terms of how we may reach some of the cohorts that we need to reach, avoid vaccine hesitancy, but also are there any concerns or issues that you are hearing from out there in the communities that are coming up that would be useful for us to know so that we can think about our ways to tackling them. If you wouldn't mind either dropping a note in the chat box or sharing an email via the COVID Community Champions address, that would be fantastic. Thank you, Tracy.
Thank you, Darsha. We've got a comment in the chat asking whether a BSL interpreter could be made available to the accessible vaccination clinic.
We are looking into that one, yes. So we absolutely want to provide interpreting services for those who are accessing. So yeah, and I will, sorry, my chat isn't updating. Was it from Val?
From Val, yeah.
Yeah, Val, I will drop you a note on that one. I am looking in the background to make sure that I can provide the precise details for the company.
That's excellent. Thank you very much. Do we have any more questions for Darsha? No, can't see any. So to conclude then, I've had a message today, an email from Amelia, and we will circulate it along with the minutes. And she's wanting me to share a poster with you. They're looking for young people between the ages of 17 to 30 with a hearing impairment. And here's the poster. It's for a health advocacy service to help young people, help them to book appointments, tell them about health worries and make a plan to get help. So that will be circulated along with the recording and the minutes of the meeting. So that concludes our COVID Champions update for this week. Hope to see you all in another couple of weeks. We've got these meetings booked in every other week until the end of March. I'm not quite sure what's going to happen then, but we will keep you informed. If any of you have got any suggestions about how we can do things differently or better, anything we're missing or anything we need to think about going forward from March onwards, please do get in touch and let us know your thoughts. Unless there are any other questions, then thank you very much indeed for joining us and taking the time to be with us today. We very much appreciate your support. Thank you, everyone. Thank you, Brenda. Nice to see you.
Thank you.
Richard, well, nice to see you, Richard. I can see you now. My screen's turned off.
Take care. Thanks, Tracy. Brilliant as usual.
Thank you very much.